Hi, this is Sangeeta introducing you to the topic headaches. Headaches, all of us have experienced them, right? But yes, you will learn a totally different perspective along with me while doing this chapter. The main objective of this lesson is to focus on what headaches are. Another objective is to focus on tension headaches. Another objective is to elucidate on what migraine headaches are. Yet another objective is to focus on what cluster headaches are. Of course, we will also discuss about the various coping strategies that will equip the person to tackle his headache effectively. Just now in our objectives, we have spoken about tension headaches, cluster headaches, migraine headaches. But to our dismay, there are around 150 plus types of headaches. Yes, tension, migraine and cluster headaches are considered to be the most common ones, but there are a lot many that people suffer from. 90% of the headache has been found to have an emotional cause. Why do we get a headache? We think too much. There is something happening inside that has an emotional bent. That is the reason why we pick up a headache. Though the tension, migraine and cluster headaches are lumped together, they are headaches of different organ systems altogether. You will find that the tension headache is more of a musculoskeletal disorder and the migraine headache is more of the cardiovascular disorder. There are roughly about 20 million migraine sufferers and 100 million tension headache sufferers across United States. Estimates of course in India have not yet been made, but it is estimated that the figures would be as alarming as they are in the United States. Tension headache is commonly described as a feeling that one's head is being compressed in a circular vice. The duration of this disorder varies from just a few hours to a few months. Mind you, it is a few months. The common tension headache is characterized by intense pain, usually encircling the head, although some sufferers report it to be localized on one side. How many number of times that each one of us would have experienced such kind of a headache? Only a certain part of our head aches. But did we give ourselves any reason as to why we got that headache? Did we think that there must have been a psychological cause, a psychophysiological cause to it? No. Pop in some other painkiller and you forget your headache. This type of tension headache usually develops due to periodic intense contraction of the face, the scalp, the neck and the shoulder muscles. So, next time you get a headache, you try to analyze what you had done earlier that you have landed in this kind of a condition. Thus, tension headache is due to the vascoconstriction caused by the contraction of the muscles that are serving the skull. This develops because there is a reduction in the blood supply to arteries and the veins that are there in the skull. These patients do not consider treatment as important. They do not realize the importance of visiting the doctor. But if the frequency of these tension headaches is high, it is strongly recommended that you visit the doctor to get it cured completely. What do these people do? They just pop in an analgesic or a painkiller and it gives them only a temporary relief. Probably after a month or two or even after a fortnight, they might again experience the tension headache. Relaxation technique will definitely help better the situation. Formal treatment consists of giving some muscle relaxant drug. Earlier we spoke that all the muscles were constricted, all the muscles on the face, the scalp, near the skull were constricted. So, a muscle relaxant treatment was found to be effective to deal with the problem of tension headaches. Relaxation techniques have been of great help and they serve as muscle relaxants also. The tension headache is also called the chronic daily headache or the chronic non-progressive headache. These are found to be the most common type of headaches that one could see in the general population at large. These headaches keep coming and going at regular intervals of time. Treating this type of headache is pretty simple and the person can be encouraged to manage his headache by following healthy habits and indulging in relaxation therapy and also indulging in good amount of exercise. Popping in a painkiller always is not a suggestible option. Choosing methods that are non-drug treatments will prove to be better in the long run. When you use these painkillers on a regular basis to ward off headache, what happens in the long run? You might develop some other problems because of the acidity that is produced by the painkillers. Studies have shown that 90% of women and 70% of men experience tension headaches in their lifetime. Middle-aged people are more prone to these kind of headaches. Now, what are the complications that tension headaches might bring about? The very apparent one is that your productivity levels will take a nosedive. When you are suffering from headache at regular intervals of time and very frequently, you will not be able to concentrate more on your work. At times, you will have to seek absence from work. As a result, there is a straight dip in the levels of your productivity. And what happens as a result? There is poor quality of life. Over-the-counter pain relievers are found to be the most sought after option, but they are definitely not the best option to deal with your tension headache. Now, we will take a look at what migraine headache is. Each one of us must have had this chance to see a person in our family itself suffering from migraine headache. His condition is absolutely pitiable, or rather her condition also may be pitiable. They are so bogged down with pain that they cannot concentrate on any other job but sleep, sleep and sleep, and that too they lie down, they do not sleep peacefully. Migraine headache is also called as one-side headache, which lasts for a few minutes to few hours. It is intense pain which is localized and associated with nausea and giddiness. We have heard our elders at home say, "Oh, you are having a headache, if you vomit you will be fine." So, there is a general notion that when a person suffers from severe headache and it is followed by nausea or vomiting, the headache will generally subside. But this is a case of migraine that the person is suffering from. There are three different types of migraine headaches that we may come across. First one is the classic migraine, second is the common migraine, third is the cluster migraine. What is classic migraine? This is that kind of a headache which includes an aura which precedes actual pain by few minutes to an hour. The aura is usually accompanied by visual disturbance, tingling feeling or numbness. What is the common migraine? Common migraine is a migraine headache that comes without the aura. Cluster migraine, this term cluster migraine refers to that migraine headache which is accompanied by sharp and stabbing pain, and this occurs in multiple episodes. Because it occurs in multiple episodes, we call it cluster migraine. Therefore, migraine headache is a vascular event where the pain arises from the scalp, its blood vessels, its muscles, from the dura mater and into the venous sinuses, and from the blood vessels at the face, neck, head, the blood vessels and the dura mater. So, it is a compounded effect that the blood vessels dilate and become congested with blood. Pain sets in because of the exertion of pressure on nerves that lie in and around these congested blood vessels. Migraine headaches can occur at any age, but they are found to be predominant in people aged between 16 to 30 years. Migraine headaches are found to be more common in women than in men and are associated with various phases of the menstrual cycle. Earlier also we have seen that it is the hormonal changes that women experience during their menstrual period that becomes the cause for quite a number of disorders. A migraine headache follows 4 particular stages. What are they? There is a stage called prodrome, then the aura, then the headache and postdrome. What happens during this prodromal stage? Just a day or two before the migraine, the person actually experiences subtle changes which indicate an oncoming migraine. You must have heard someone say, "Yeah, I am getting a feeling that I might get my headache again." So, there may be constipation, there may be cravings for some kind of food, there may be hyperactivity, there may be irritability, there may be depression, stiffness of the neck and uncontrollable yawning. When such symptoms occur, they do occur in the initial stages of, or they are just warning signals that your migraine is on its way. Second stage is called the aura stage. This occurs during the headache. Aura is visual disturbance like a flash of light. So, these people do not want to sit with their eyes open. They feel much comfortable when their eyes are closed and they are rested. Majority of the people may not experience this aura, but they experience the migraine headache. The third stage is the actual headache or the attack. The frequency of each of these stages differs from one person to another. One particular person may have migraine for more than once in a month, but another person may get it only once in 6 months. During migraine, the person may experience pain on just one side or on both sides. This pain is a stabbing pain and throbbing in nature. There is blurred vision, there is nausea and vomiting, there is dizziness and also great sensitivity to light. He wishes, or the person wishes, to sleep only in the dark. The final stage is the postdrome stage. This stage occurs after the migraine attack. It is during this stage that the person feels totally drained out of energy. However, there are a few people who may feel euphoric also. The exact etiology of migraine headaches is not known, but again family history forms a strong base and suggests that if it exists in the family, there is a high chance that people also might inherit the same. A parent or a sibling already having this condition in the family only increase the risk of others in the family to develop the condition. Migraine is generally associated with some kind of odors, noises, sensitivity to light, loss of appetite, stomach upset, nausea or vomiting. If a child has migraine, he or she looks pale, feels dizzy and has stomach upset, fever, blurred vision along with other symptoms. Hormonal changes in women, exposure to certain kind of foods or eating certain types of food additives may trigger off a migraine headache. So, when there are unusual smells, when there are loud sounds, you have to be just careful enough, see to it that you move away quickly from that place so that you do not catch a migraine headache, because the kind of suffering you will have to go through only you will understand, not your friends or close relatives. Unlike the tension headaches and migraine headaches, cluster headaches are less common ones. What are cluster headaches? They are considered as a type of primary headache and the pain caused is extremely intense. Though they are the rarest form of headaches, they are the most intense ones too that cause a lot of pain. It may be described as having a piercing or burning quality which is constant and throbs the head too. The pain is extremely intense to the extent that the sufferers cannot sit still at one place, they keep walking up and down the place. The term cluster headache refers to those headaches which have the characteristic grouping of the attacks. Generally, the pain is experienced in the eye region or in the region behind the eye. This headache may occur for 1 to 3 times in a day during the cluster period. And this cluster period may last from 2 weeks to 3 months. These headaches may disappear altogether only to recur after a long gap. This kind of headache has the quality to wake up a person from his deep sleep in the night. We must have heard many people say, "Oh, I caught a headache in my sleep today." It starts off with a piercing pain around the side of the head or around the eye. Fortunately for all the cluster headache victims, this is nothing serious at all and is in no way life-threatening too. There are a lot of treatment options that will help people come out of their tension headaches, migraine headaches or cluster headaches. With the help of these options, you can make the headaches less frequent episodes, less frequently recurring episodes. You can make them less severe and last for a shorter period of time. Medication, of course, will help in reducing the number of cluster headaches you may experience. What are the symptoms of these cluster headaches? As mentioned earlier, there is one-sided excruciating pain behind the eye or near the eye, and it radiates into other parts of the face also. The person experiences a lot of restlessness, redness in the eye and inconvenience also in the places where it is affected. There is excessive tearing of the eye, there is a swelling around the eye. These people generally avoid lying down because this position will only seem to increase their suffering and pain. So, during the cluster period, a person may have a single attack that lasts for 15 minutes to 3 hours. The pain may subside with the same suddenness with which it had occurred. Though the case of cluster headaches is relatively unknown, scientists have found that perhaps it is the hypothalamus that is the responsible factor in bringing out these types of headaches. Unlike migraine, the cluster headaches are not associated with any triggers like hormonal changes, foods or stress. A family history, alcohol, smoking, age are found to be the main risk factors for cluster headaches. Men are believed to experience this headache more when compared to their women counterparts. In addition to the tension, migraine and cluster headaches, there are also other headaches called the sinus headache and the mixed headache syndrome. You must have seen many of people who are victims of this condition called sinusitis. Yes, they also cannot bend their head down. They feel very heavy around their nasal region. This sinus headache, which brings about a deep pain in the cheekbones and also in the bridge of the nose and forehead. The pain intensifies when there is a sudden head movement or strain that is accompanied with other sinus symptoms. The mixed headache syndrome is called so because it is a combination of the tension headache and migraine headache. This mixed headache is experienced by adults as well as children. What are the causes of headaches? There are the biological causes as well as the psychosocial causes. What are the biological causes? Headaches usually appear to be primarily due to the changes that occur in the vascular system, and most importantly because of the changes that take place in the coronary arteries. Some researchers have suggested that it also may be because of genetic causation that migraine is being passed on from generations to generations. When we talk about the psychosocial causes, there is a great deal of research evidence that suggested that when individuals are unable to cope up with their personal function and conflict, they develop a lot of pressure around their intracranial region, and this brings about a lot of headache and at times end up in the person suffering from a migraine headache. Kolbe described a typical migraine headache victim as a tense, driving, obsessional perfectionist with an inflexible personality, maintaining a store of bottled up resentments that can neither be expressed nor resolved. So, when there is a lot of emotional pressure built up within the person, it will definitely trigger off the person into having a bout of headache. What is the treatment for headaches? People suffering from headache should first and foremost learn to relax. Relaxation techniques are definitely going to help them in the long run. They need to ensure that they spend at least half an hour to master these exercises so that there is a sense of calm that first sets in their mind. Use of these exercises may help prevent post-stress headaches. These people need to regularly participate in enjoyable hobbies and relaxation activities. Planning for some kind of a recreation might always divert their attention from their condition towards other things. So, when the person engages in regular physical activity and when he sticks to a proper diet and follows good lifestyle habits, he can definitely tackle his problem of recurrent episodes of headache. In some cases, migraine is treated as being a form of suppressed anger, hostility and guilt. Honest expression of these feelings of guilt to the person concerned will definitely help in catharsis and also ensure that the frequency of these headaches is reduced to a great extent. Psychotherapy may be necessary in quite a number of instances, which will help the person release his pent up emotions, and with the help that is extended by the counselor, he can modify the characteristics that are associated with the migraine personality. Some individuals report a lot of relief from migraines after they quit smoking. It is possible that products of combustion also have a great influence on the person getting this kind of a disorder. There are a lot of headache beliefs and cognitions that people suffering from headaches may have. What are they? Cognitive processes, what do they include? Cognitive processes are nothing but the thoughts, attributions and beliefs, attitudes that people have when they are interacting with the environment. When we take headache into consideration, cognition of this person influences whether he will engage in such kind of a behavior that will lessen the problem, or whether he will stick to the Medicare regimen, or how he will cope with in case of a headache attack. If you keep on telling yourself that you will get a headache, you will get a headache, you are in a way reinforcing your own thought process, your own cognitions, and you are bound to get a headache soon. So, a lot depends on the kind of cognition that takes place in the minds of the sufferers. There are basically two types of cognitions that are found to be extremely influential while people are handling headaches. The first one is the self-efficacy and second one is locus of control. What is self-efficacy? Self-efficacy refers to the belief that the individual himself can tackle the condition successfully and he can take a course of action that will give him respite from his given condition. Locus of control refers to the degree to which the individual perceives that a particular event is totally under his control. These beliefs range from internal locus of control to external locus of control. When it is internal locus of control, the person feels that he is the one who is solely responsible for his condition. When it is external locus of control, the person feels that it is the external factors or some other XYZ who is responsible for his condition. Many headache sufferers do not give much significance to these psychological factors, but when you actually get down to the etiology of the headache, you will see that it is a psychophysiological disorder. Even though you try to subside the headache with a pill or a painkiller, the psychological aspect is not being treated. Therefore, these psychological factors should not be undermined at all, because they may be the main etiology of the entire situation. When these aspects are addressed by the right kind of help, people can definitely imagine themselves leading a very happy and pleasurable life. So, we have seen that there are different types of headaches that people may suffer from: tension headaches, migraine headaches, cluster headaches, the sinus headaches and the mixed syndrome headaches too. But whatever be the type of headache, it calls for a better lifestyle change, better dietary management, good amount of physical exercise and relaxation techniques, most importantly, to deal with the disease called a headache.